Hi, I'm Nick the Nurse. Today we're going to be talking about the signs and the symptoms of a patient who has an aortic aneurysm. Now this frequently comes up on nursing school exams and on the NCLEX, so you got to know this cold. For an unruptured aneurysm, there's differences between ruptured aneurysms, which are obviously a lot more painful and a lot more life-threatening, and unruptured aortic aneurysms, which we'll talk about that in a minute. Anyway, unruptured signs and symptoms include pain in the lower back and abdomen. That is the #1 classic telltale sign. Also, a pulsating mass in the abdomen. Obviously, we have veins and we have arteries that go all throughout our body. However, in a patient who has an aortic aneurysm, there might be a more pronounced pulsating mass in the abdomen that you might not ordinarily see in a patient who doesn't have a pulsating mass in the abdomen. Also, you might see tachycardia, you might see a bruit. Remember that from renal over the aneurysm site. Patient might also have hoarseness, dyspnea or shortness of breath, syncope, cyanosis, hypertension, weakness, and diminished peripheral pulses. In a patient who has a ruptured aneurysm, they're going to have severe pain. Now we're talking about like a tearing pain. Like if someone were to tear your heart or your muscles, just like a gut-wrenching, tearing pain. Tachycardia, obviously because the patient's going to also go into shock. And they'll also have the resultant hypotension that accompanies that. So those are some of the signs and symptoms. If you look at the classics, what they're most likely to test in nursing school and probably on the NCLEX are for an unruptured aneurysm, you're going to have pain in the lower back and abdomen. It's going to be bad. But the other thing is when you have a ruptured aneurysm, you're going to have the most severe tearing pain that you've ever had in your life. And if a patient has that, well, you'll have to wait and see what happens for interventions to find out what we're going to do for that. Anyway, again, I'm Nick the Nurse. We appreciate you watching this video, and we'll hope you'll join us next time. Thanks.